Hello, welcome everybody. O class Mariah Charleson, Heshquiaxups, Kinquashtaklumthaxups. My name is Mariah Charleson. I'm from Heshquit and I belong to the House of Kinquashtaklumth. I am the Vice President of the New Chanoth Tribal Council and I am here today with our COVID-19 NTC nurse, Kelly Dennis from Ahousaht First Nation. We will be providing a short update today and some really positive, uplifting news that Kelly will be delivering. I want to let all of our new Chanoth know, regardless where you live, that NTC continues to advocate for you. And we continue to advocate for access to the COVID-19 vaccine, which we know is a critical tool to protect our people against this deadly virus, COVID-19. As we continue to advocate, we have some exciting news. But before we bring that exciting news, I would like to take this opportunity and this time to remind all of our new Chanoth people, regardless of where you live, to please continue following the current public health orders. There will be a link at the end of our presentation today to the current public health orders, as well as the phone numbers to register for the COVID-19 vaccine. So that's another message I would like to share is please help your loved ones get registered for the COVID-19 vaccine, as it is a really critical tool to protect us from this virus. Tleko, and at this time I will turn it over to Kelly Dennis. Thank you. Choo.
Thanks, Mariah. Hello there. My name's Kelly Dennis, and I come from Ahousaht. As Mariah was saying, it's very important that we continue to maintain, safe distancing, wearing masks, washing hands, sanitizing, that sort of thing. We are in the process of rolling out our vaccine, and we've managed to vaccinate our remote communities so far on the West Coast, first and second doses. We are now getting into the urban rollout, and I'm sure all of you have heard that there has been some changes to how we've decided to give the vaccine. Initially, we were doing a first dose and then a second dose up to 42 days after the first. This has changed now up to 4 months. The reasoning for this is research has found that the first dose is about 92% effective. So it protects you up to 92%, and it lasts for about 4 months. And when you get the second dose, it's going to bump it up only by a 3% difference. And the good thing about this, though, is that it's going to make it last a lot longer. So I hope that clears a little bit up. The other thing is, originally we were giving the Moderna vaccine. You might be hearing now a little bit of difference. We'll be giving the Pfizer vaccine. There's not a whole lot of difference aside from the fact that it's like a manufacturing brand name. It's going to give you the same efficiency as Moderna. So I wouldn't worry too much about the brand names. They're going to give you the same results either way. The other thing I can mention is we're going to start rolling out within the community of Port Alberni here. And we're going to be starting next Monday, Tuesday, Wednesday at the Friendship Center. And the times will be 9 o'clock in the morning till 3 o'clock in the afternoon. We are wanting you to call in the center to make appointments. And Mariah had mentioned earlier that we're going to provide a 1-800 number at the end of this, and that's how you will make appointments. There will also be walk-ins. So if you don't make an appointment, you can walk in. You'll have to wait a little bit longer because they have to get some other information from you. So we are in phase 2 of the rollout, and this is covering our Indigenous populations, Métis Inuit over the age of 65. And the Friendship Center is going to be our first clinic starting this Monday and Tuesday and Wednesday. We are wanting you to make appointments with the 1-800 number, which will be provided at the end of this presentation. We also will have walk-ins. The walk-ins, though, will take a lot longer than if you make an appointment because we have to gather some more information from you. So I really hope that all of you can make it. Um, the other important piece to this is once you're vaccinated, that doesn't mean that you're completely 100% protected. Um, you still have that 93%. So you have that small little portion that, you could potentially be a carrier. And if that's the case, those who are unvaccinated could potentially get COVID. So your loved ones could get COVID. The ones who cannot get vaccinated are people under the age of 18, those who are immunocompromised, those with complex diseases, those who are allergic, those sort of things. They're unable to get the vaccine, so they're not protected. So it's really, really important that you go and get your vaccine. Yeah. Anything else to add, Mariah?
I was just thinking maybe the only possible other thing is to, for those that need to speak to physicians, to speak to their physicians prior to their appointment that could possibly be Monday to Wednesday. That's the
Our clinics are going to be starting March 15th, 16th, and 17th. And then to follow up and watch out for other clinics because this is going to be kind of a continuing thing.